It seems as if I just spoke to you yesterday, Joanne, but I did.
Yeah, you certainly did.
I'm so glad you're back.
Thank you.
Okay, so let's talk about chronic illness and disease. Half of Canadians report at least one problem. Isn't that scary? Isn't
It
that
is
awful?
scary, and it is very common. This is what we've seen at MedFit Rehab and Vital Steps. When people come in, one of the first things we have to do is an assessment. If we don't do an assessment, we don't know who we're dealing with. And of course, when we ask for the various health issues, it's incredible the number of health issues. They'll have osteoporosis and they'll have arthritis. They'll have rheumatoid arthritis and they'll have fibromyalgia. They'll have diabetes and they'll have arthritis. It's generally
What an
more
exciting day you have.
It's very exciting. That's what makes the work actually really rewarding. You have to think and come up with the right programs and the right prescription, and then that makes it fun. Not fun for those guys, but makes it fun for us
you.
because it's not just a standard exercise program that we design. But chronic illness is basically a long-lasting condition that stays for a long period of time, probably for several months to several years, versus acute conditions where they kind of come suddenly and then they go away. So chronic illnesses are generally involve your standard things like arthritis, diabetes, osteoporosis, cardiac illnesses, fibromyalgia. These are all long-lasting chronic illnesses that generally don't have a cure. They're going to be around for a long time. If you have it, you're going to have it for a long time. You know how many people have arthritis.
Lots of people.
And
they have partial arthritis.
Exactly.
It doesn't matter how old you are. You can be very young and you can have arthritis in the knee, arthritis in the elbow and that. Do you ever talk about the emotional aspect of these problems that people have? Because usually there's something that changes in their lives or starts at some point that it happens. I mean, you don't get arthritis. Where do you get it from? Where do these things come from?
Well, basically, a lot of times it's poor lifestyle choices, poor nutrition, lack of exercise. Sometimes it's genetic. I've met people that have arthritis that racks their whole body, but then when you ask them, did your parents have arthritis or diabetes or whatever? And generally, they've had it too. So some of it is actually genetic, and in others, it's created from poor lifestyle choices.
I refuse to have anything that anybody else had. I have my own, system of. So how does exercise basically impact chronic illness, and how do you choose the right exercise for the right disease?
Well, exercise has a major play when you have chronic illnesses. If you have a chronic illness, exercise is one way to maintain mobility and strength, as well as decrease pain. If you don't have any of those chronic illnesses, exercise is a way to prevent it. Okay. So it's prevention. That's one of our biggest mottos. An ounce of prevention is worth a pound of cure. I mean, The point is, if you can exercise and keep that as part of your general overall lifestyle, you can really reduce a lot of these chronic illness issues. Now, how about exercising? Exercising is key when you have these chronic illnesses, but it's what you do. It's how you exercise, because certain exercises can compound the problem and make it worse. Sure. But if you get the right kind of medically prescribed exercise programming, which is what we do at MedFit, if you get that right program, and when you can decrease your pain, you can actually increase your mobility, your strength, your stamina, which, makes you feel a lot better in the long run than just sitting down in a chair and saying, well, I can't do anything because I'm in pain and discomfort.
Well, that's what I have heard that so many times from so many people. Mm-hmm. How can I exercise when I'm in such pain? I said, well, you're going to be in more pain if you don't get off your butt and do something.
You're absolutely right, Zelda. That is the biggest problem, is because they have become inactive. We're going to talk about sarcopenia in another one of the other shows.
Next one, probably.
Yeah, probably. And it's all about muscle wasting and not doing anything to maintain strength, core strength, stability, mobility, flexibility, all of these different things.
Okay, Joanne James, we're going to talk to you again tomorrow because this is very exciting, and I certainly hope that our audience is getting off that chair and going to do something important to maintain that mobility, and I hope that they call you at MedFit Rehab. Okay, see you tomorrow. Talk to you tomorrow.
Thanks,
Bye.
Zelda.
Bye.